Hi, hello everyone. Welcome to Easy Nurse, where nursing education made easy. So let me start with the series that is the Lakshya 3.0. Here mainly we are going to discuss with the main important question and answer that is going to come for your upcoming exams. So let me discuss about the GNM second year child health nursing. The students who all are going to write for the GNM child health nursing, please listen, be attentive, so you can score a good marks. So as coming with your question answer pattern, so in the question answer pattern you all know there is a questions that will be coming with the true or false also, right? So let me discuss about the true or false first. So first question, it will be there like this, that is a immunization helps in preventing a communicable disease. So whether it is a true or false, so the answer is true. So you all know the immunization we are going to give for the child to prevent the communicable diseases, that is especially we are going to give to kill the 6 killer diseases. That is the main intention for going to give this immunization, that is prevent the communicable diseases. That is what it is going to happen in a children's. The next question it will be there, that is a Apgar score is used to assess the nutritional status of the child, whether it is going to check the nutritional status of the child, whether it is a true or false, it is a false. Next question, that is a exclusive breastfeeding should be continued for 6 months of the life, as according to the WHO, exclusive breastfeeding, we have to give the exclusive breastfeeding for the baby, that is this answer is a true. Next is a measles is caused by a bacterial infection. So whether is a measles is a bacterial infection? No, it is a viral infection. So the answer is a false. The next question it will be there like a pediatric nursing focus only on the physical health of the child. Whether the pediatric nursing or a pediatric, when you coming to the branch of the child, the branch of the science that is going to deal with the care of the child from the conception to till adolescence, we are going to deal in all the aspects, that is not only with the physical health, that is this answer is a false. Next, coming to the vitamin D deficiency causes the rickets in the children. So vitamin D deficiency, it causes a rickets in the children. Usually this answer is a true. Next, coming to the large head is also known as a microcephaly, as the large head is called as a microcephaly, so the answer is a false. Next question, it will be there like a cerebral palsy is a most frequently permanent disability of the childhood. As you all know, that's a cerebral palsy, it is causing a disability in the child, so the answer is true. Next question is green stick fracture are common in young children. So you all know usually when the child is come across with any fracture, the child will be having a green stick fracture, that is a commonly we are going to see in a children, so the answer is a true. The next question is a osteomyelitis is an inflammation of the bone, that is a true. So osteomyelitis is a inflammation of the bone. So these are the true or false. Usually this type of the question they are going to ask in a upcoming exams. So the next question it will be there like this, that is coming to the exam pattern, the fill in the blanks also it will be there. So let me discuss about the fill in the blanks. First question, that is the normal temperature of the newborn baby is. So you all know the normal temperature of the newborn baby is 36.5 Celsius to 37.5 degrees Celsius. The next question is first milk produced by the mother after delivery. So which answer is this? That is a colostrum. The first milk that is produced by the mother soon after the delivery, that is what we are going to call it as a colostrum. Next one is the weight of the baby usually doubles at and it will be triples by the 1 year of the age. So when you all know when the baby has born, usually the doubles of the weight of the baby it will be happening at the 5th month of the child. Okay, when the child is reaching with the 5th month, the weight of the baby it will be double and the weight of the baby it will be triple by the 1 year of the age. The next question is the vaccine given at the birth is. So which vaccine we are going to give at the time of the birth is a BCG. The next question it will be there, dash vaccine prevents the liver infection caused by the virus. So which vaccine usually we are going to give for the prevention of the infection of the hepatitis. Usually what we are going to give hepatitis B for the prevention of the infection of the liver. Next one is a refers to the bluish discoloration of the skin due to lack of the oxygen. So what we are going to call it as a cyanosis. So any bluish discoloration of the skin, usually we are going to call that medical term is a cyanosis. The next one is a child is able to hold the head hut. So when the child is having that milestone reaching with the holding of the head is at the age of the 3 months. Next question is the period from 1 to 3 years of the age is called. Usually the period between that is 1 to 3 years of the age, you all know that is called, we are going to call it as a toddler period. Next is dash is caused by the deficiency of the protein. So which condition usually it will be caused by the deficiency of the protein? Kwashiorkor and the marasmus. So these are the two conditions usually it will be occurs as if it is any deficiency of the protein, it is happening in the children. The next question it will be there like a mumps is an acute infection disease that is caused by. So which virus it will be causes the mumps, that is a paramyxovirus. So these are the type of the fill in the blanks usually they are going to ask in a main exam. So for more explanation, for more information about the true or false or a fill in the blanks questions, usually you can visit the Easy Nurse where you can able to download it from the web app or a Play Store app. Next, let us discuss about the meanings. So when you coming to the meanings, like a which type of the what type of the meanings they are going to ask for your upcoming exam. If the question they are asking like this, hyperbilirubinemia. So what is this? An abnormal high level of the bilirubin in the blood, often caused by the usually it will be often causes the jaundice in the children's. So usually what will happen because of this, there is a yellowish discoloration of the skin. It will be there along with the heights. So usually this condition we are going to see in a newborn children. The next is a restraints. So what do you mean by restraints? So you all know restraints are the type of the device or a methods that is usually we are going to use for the children to limit the movement. So limit the mobility or a movement of the children to ensure that safety or to prevent the injury during the time of the treatment. Like if the child is admitted in the hospital, either if you are going to give some IV infusion or if the child is undergoing surgery, so by that time to prevent the mobility of the child, so we are going to use these restraints. Next is a tics. So what are the tics or what do you mean by this tics? Tics are the sudden repetitive involuntary movement or sounds. Either the involuntary movements also it will be there, or it may be sounds also the child will be making by a person. Usually commonly what we are going to see in the condition like a Tourette syndrome. So in this condition we are going to see this is a tics. Next one is a low birth weight. So or a LBW also what we are going to call. So a condition in which the baby born weight, the weight of the baby it will be there that is less than 2 kilograms or a 2500 gram. If it is less than 2500 gram, if it is there, either it may be regardless of their gestational age, we are going to consider the child is a low birth weight baby. Next one is a child abuse. So child abuse it is referred to intentional harm or a mistreatment or what it will be there, that is a neglect of the child by the parents or a caregivers, or it may be others, that will be causes with the physical, emotional, sexual or a psychological damage to the child. So if the child who is the parents are not taking care properly, either it may be some mistreatment they are going to do with the child, or it may be neglecting with the taking care of the child, that is what we are going to call it as a child abuse. So because of this child abuse what will happen, usually the child will be go with the either it may be with the physical, emotional or a psychological some damages that will be happening in a childhood growth. Next one is a school phobia. So what do you mean by this school phobia? This school phobia also called it as a school refusal. So usually you are going to come across with the children as a unreasonable fear or some anxiety it will be there to go for the school, that will be leading to the repeated absence or a refusal to attend the schools. Usually we are going to see this school phobia or a school refusal in between the age of the 5 to 14 years of the age of the child. Next is a club foot. So when you coming to this club foot, it is a one of the congenital deformity of the foot. So it is a one of the congenital condition what we are going to in a deformity of the foot, in which what will happen, either it may be twisted inward or it may be with the downward, it will be there. Either it may be affecting with the one or it may be with the both feet. That is what we are going to see, it making a normal walking difficulty. Like if you are not treating in a earlier stage of the child, as you come across with the child is having a club foot, that will be it will be leading with the many complication in a further. So these are the main meanings what it will be there. So for the further meanings what you are going to know about the like which type of the meanings it will be coming, visit with the EasyNurse, where you can able to download it with the web app or a Play Store app. Then coming to the next question, either it may be like a asking with the pneumonia. So what do you mean by pneumonia? So pneumonia is one of the acute infection of the lungs causing the inflammation of the alveoli or a bronchioles, it will be there. So because of this what will happen, that will be leading with the impaired gas exchange, it will be happening. So when it coming to this pneumonia, it is one of the most causing with the morbidity and the mortality in the children, especially with the age of the under 5 children what you are going to see. So there is a higher risk of the mortality rate under 5 children because it's happening with the pneumonia. So when you coming to the causes of the pneumonia, there is a many factor of the causes that will be affecting with this pneumonia. Either it may be a bacterial, viral or a fungal, or it is a main rare cases, but in some other factors also that will be affecting with the pneumonia. So when you're coming to with this bacterial pneumonia, so bacterial pneumonia like for example when you take like a streptococcus pneumonia or a staphylococcus aureus or Haemophilus influenza, that will be causes with the pneumonia. Viral infection like a respiratory syncytial virus or influenza virus or adenovirus. So coming to the fungal infection, it is a rare cases, sometimes it may be happening with the candida or aspergillus, it may be happening. Either it may be mostly what you are going to see in the children's like a immunocompressed children, it will be there. Coming to the rare factors like if the child who is a malnourished, either it may be because of happening with the protein allergy malnutrition, or if the child who is having a like a premature birth or a low immunity, or if the child who is exposed to the smoke or a pollution, it will be there. So this is the what you are going to see with this pneumonia. Next we will see what are the main clinical features the child will be having. If the child will be having with the pneumonia, the child will be having with the like a fever, chills, it will be there. Usually the child will be having a cough, either it may be with the dry or a productive. Then there is a rapid breathing, that is what we are going to call it as a tachypnea, and the chest indrawing, it will be there, or the chest retraction what you are going to see. And there is a in a more like if the condition is not treating in earlier stage, so there is a nasal flaring also you are going to see, and the grunting or a wheezing, it will be happening. And there is a cyanosis in a severe cases of the as a complication, and the lethargy will be there, poor feeding, irritability. So these are the main thing. Along with that, when you coming with the infant, usually the child will be having like a poor feeding, vomiting, apnea will be there. Then in a older children, usually the child will be telling about the complaint of the chest pain, headache and the malaise. Then how we are going to do the diagnosis of this pneumonia? Usually with the clinical examination, that is with the breath sound, you have to check it out. Along with that, the child will be having like a fever, tachypnea also, and with the investigation we have to rule it out whether the child is having a pneumonia or not. With that we are going to rule it with the chest x-ray. With that we are going to see there is a consolidation will be there, and the infiltrate also will be there. Then there is the CBC level also, it will be increases the in the CBC when you are going to check with, there is a WBC levels, it will be increased. That is what we are going to call it as a leukocytosis. Then there is a blood culture when you are going to send, there is a bacterial some condition, if it is there we can send for the blood culture, and the pulse oximetry, that is what we are going to check with the oxygen saturation. So with this we can able to rule out with the diagnosis. Next, the management. What is the management? Usually we are going to give with this pneumonia like a oxygen therapy we are going to give as with the treatment if the child will be having a hypoxia, and the antibiotics usually we are going to give as on the basis of the cultural studies with the suspected organism, and the antibiotic for the fever we are going to give for the child, and the fluid usually we are going to give as to prevent the dehydration, and the nebulization if the child who is having a wheezing. Next, coming to the another condition, that is a ventricular septal defect, or a VSD, what you are going to call. Ventricular septal defect is one of the congenital heart defect that is caused by an abnormal opening in the septum. So usually what will happen, there is an abnormal opening in the septum, it will be there, that is in between the ventricles. So in between the ventricles, that is in the septum, in between the right ventricles and the left ventricle, it will be there. Usually the shunting of the blood, it will be there here from the left ventricle to the right ventricle. So usually this ventricular septal defect, that will becomes under the acyanotic heart diseases. As you all know, the congenital heart diseases, we are going to divide it with the acyanotic heart diseases and the cyanotic heart diseases. So this ventricular septal defect, that will becomes under the acyanotic heart diseases. So what are the main causes for this ventricular septal defect? Either it may be like a genetical factor, usually this ventricular septal defect is associated with the Down syndrome or any other some congenital chromosomal abnormalities. If the child who is having also, there is an associated factor of this ventricular septal defect, it will be there. Along with that, what will happen if the ventricular septal defect, usually we are going to see if the environmental factor that will be affecting, like during the time of the pregnancy, if the mother who is having any maternal infection, or if the mother is taking any drugs consuming or alcohol if she is taking during the time of the pregnancy, that is also one of the leading cause for the developing of this ventricular septal defect. Next, what are the main clinical feature you are going to see with this ventricular septal defect? If the small ventricular septal defect, if it is there, so usually the child will be asymptomatic and detected via murmur only. Okay. Then coming to the moderate and the large ventricular septal defect, if it is present, usually the child will be having a tachypnea will be there, dyspnea will be there, fatigue usually during the time of the feeding. Along with that, the child will be having a poor weight gain. As compared to the normal child, the weight gain, it will not be there with this child who will be having a ventricular septal defect. Along with that, you are going to see there is a failure to thrive and sweating, especially during the time of the feeding, the child will be telling. And usually if the mother during the time of the feeding also, she can able to find it out, the child will be having so much of sweating, and the recurrent respiratory infection, usually the child will be come across, and there is a palpable thrill or a harsh holosystolic murmur at the left sternal border, what you are going to see. Then coming to the diagnosis, usually with the clinical examination, murmur and the thrill, sign of the heart failure, it will be there with this child. So usually the investigation, we are going to rule it out with the echocardiography, that is we are to check with the size and the location of this ventricular septal defect, and the chest x-ray, that is cardiomegaly and the pulmonary congestion, it will be there with this chest x-ray, and the ECG, usually you are going to see there is a ventricular hypertrophy. Next, usually the management, what you are going to see give for this child who will be having a ventricular septal defect. For the small and the ventricular septal defect, as we are going to make that is a observation for a particular period of the time, as it will be closes by itself by spontaneously. And if the moderate or a large ventricular septal defect, if it is present, usually we are going to give with the medical treatment like a diuretics, reduce the fluid overload, especially, and the digoxin to improve the cardiac contractility, and we are going to give with the ACE inhibitor to especially to reduce the afterload. And the surgical intervention, usually they are going to give with this ventricular septal defect, that is a closure of the ventricular septal defect, especially they are going to do with the surgery only, that is on the basis of that where the particular defect is there and the size of the defect is there, they are going to do with the cardiac catheterization for the selected cases. So for the more explanation, you can visit with the Easy Nurse, where you can able to download it with the web store or a app store. Next, we will see with the factor that will be affecting with the growth and development. So this is one of the most important question, usually that will be asking in a frequently with the examination sector. So coming to the what are the main factors that will be affecting with the growth and development? There is many factors that will be affecting with the growth and development. As you all know, we are going to classify it with the factors that will be affecting with the growth and development with the prenatal factor and the postnatal factor. So coming to with the prenatal factor, usually there is a genetical factor and the prenatal factor that will be affecting. That is a, when you coming to with this prenatal factor, usually the genetical factor. So genetical factor means usually the inheritance trait from the parents, such as with the mother and the father, that how that will be affecting with their height, body build and the intelligence of the child, everything what we are going to see with this in genetical factors. Then coming to the some prenatal factor, especially like if the mother during the time of the pregnancy, how the maternal health it will be there. That is if the mother who is having any if the mother who is having any infection, or if the mother who is not taking a proper nutritional diet, either it may be if the mother who is consuming any drugs, or if the mother who is having any disease condition, especially during the time of the pregnancy, all this that will be affecting with the growth of the fetus. That is what we are going to consider with this prenatal factor. Then coming to the postnatal factor, that is with the postnatal factor means after the birth of the baby, like nutrition, that is the most important. That is how that will be affecting with the growth and development of the child. So adequate and the balanced the diet, that is the most important for the normal growth of the child. If any malnutrition is there, again that will be affecting with the cognitive, emotional and the physical aspect. All this aspect that will be affecting with the normal growth and development of the child. Then coming to the endocrine factors, like hormones also that will be influencing for the growth and development of the child. That is a growth hormone, thyroid hormone and the insulin influencing. All these hormones that will be influencing with the growth and development. Then coming to the environmental factor, like how the physical, social and the emotional surrounding it will be there. All this also that will be affecting with the growth and development of the child. Then coming to the socio-economic status, like usually the access to the health care, like if the child is not feeling well, how the care they are going to give as on the basis of the economic status of the parents. So if they are giving a good care for the child and good health care for the child, so the child upcoming of the health it will be there good, and how they are going to give the education, nutrition, food, play, everything that will be an aspect for the growth and development of the child. So that is what it will be influencing with the socio-economic status of the parents also. Then coming to the emotional factor, like how the parents they are showing more love, security and the parental care, that will be promoting with the healthy development of the child. Then cultural and the family practices, that is how it will be influencing with the habit, diet and the behavioral formation in the future growth of the child. So these are the main factors that will be influencing with the growth and development. So for the further explanation, you can visit with the Easy-Nurse, where you can able to download it with the Play Store or a App Store. The next question, it will be there like emergency challenges in a pediatric care. So which are the main emergency challenges you are going to come across with the pediatric care? So there is some emergency challenges, like if the child have come to emergency condition, like usually it will be there with the respiratory distress or a failure, it will be there, or some cardiac arrest, or seizure, or a status epilepticus, or a shock, either it may be with the hypovolemic shock or a septic or a anaphylactic shock the child will be having, or a severe dehydration or a trauma or a head injury, poisoning or a burns and the severe infection. So infection especially you can able to see like some meningitis or a sepsis in the child. So these are the main emergency challenges that will be coming in a pediatric care. So this if the child who have come with this pediatric emergency care, so they require with the rapid assessment, airway management, IV fluid, oxygen and the emergency drugs. Next is a malabsorption syndrome. So what do you mean by this malabsorption syndrome? So it is one of the condition in which what will happen, that in the intestine is unable to absorb the nutrients properly from the food. Like intestine not able to absorb the proper nutrients. So what are the main causes for this malabsorption syndrome? Either if the child who will be having some celiac diseases or a lactose intolerance, if the child who will be having, if the child will be having a pancreatitis, that is especially chronic pancreatitis, or a cystic fibrosis or a intestinal infection. So these are the causes that will be causing for the malabsorption syndrome. Then what are the main symptoms you will be come across with the child who will be having this malabsorption syndrome? So usually the child will be having a symptoms like a chronic diarrhea. The child will be telling like usually the child will be having a chronic diarrhea, weight loss, it will be there obviously, and there is a abdominal distension, what you are going to see. The child will be having a fatigue and the nutritional deficiency. So what is our management usually we are going to give with the child who will be having this malabsorption syndrome? So usually we are going to identify and treat the underlying cause. That's the most important nutritional support we have to give, that is especially with the high protein and the vitamin rich diet we are going to give for the child, and the enzyme replacement therapy if it is needed we are going to give. Along with that, anti-diarrheal and the vitamin supplements also we are going to give for the child. So this is what the management we are going to do for the malabsorption syndrome. Next is one of the most important repeated question that is asking in a exam, that is a tracheoesophageal fistula. That is what we are going to call it as a TEF. So what do you mean by this tracheoesophageal fistula? So in the word only you can able to see that's a tracheoesophageal fistula. Usually here the fistula it will be there. Fistula means there is an abnormal connection. So here the abnormal connection that will be there between the esophagus and the trachea. So that is a trachea, esophagus, there is a abnormal connection it will be there. That is a tracheoesophageal fistula. It's one of the congenital anomaly in which what will happen, there is a abnormal connection, that is a fistula it will be there between the trachea and the esophagus. So often associated with the esophageal atresia also. So usually what will happen, atresia means there is a narrowing it will be there. So oftenly there is a sometimes there is a esophageal atresia also it will be there with the child. So there is a different type of the tracheoesophageal fistula, that is a type A, B, C, E, like that. So coming to the type C, it's a most commonly condition what you are going to see with this tracheoesophageal fistula. So here what will happen, the proximal esophagus hangs blindly and usually and the distal esophagus connected to the trachea. So this is what you are going to see, the proximal hand it will be blind and the distal hand it will be connected with the esophagus. Then type A. So usually what will happen with this type A, the esophageal atresia will be there, there is no fistula. So this is what the esophageal atresia. So there is no connection between the trachea it will be there, only the atresia will be there with the esophagus. Then type B. So this is the type B, the proximal hand it will be having with the connected to the trachea, that is a fistula it will be there, and the distal end it will be there with the blind pouch. And the type D, usually what will happen here, the both the distal and the proximal end of the esophagus connected to the trachea it will be there. So this is one of the rare case what you are going to see. So these are the different type of the tracheoesophageal fistula. Then coming to the what are the main clinical features you are going to see with the child who will be having this tracheoesophageal fistula. So excessive salivation will be there, along with that you are going to see there is a drooling will be there. Then there is a choking, coughing, cyanosis during the feeding, regurgitation of the milk it will be there, and there is a respiratory distress, apnea, tachypnea. Then there is a abdominal distension, especially in a distal fistula you are going to see with this, and there is a failure to pass the nasogastric tube into the stomach. So this is what the clinical features. Then how you are going to do the diagnosis with the proper clinical signs, that is if the child will be having a choking, cyanosis or a inability to swallow, all these things we are going to see with the condition of the child as with the clinical signs. Then we are going to do with the proper investigation, that is a attempt to pass the nasogastric tube, that is we can't able to pass it, that is cannot able to reach to the stomach. That is what we can able to make the confirmation of the tracheoesophageal fistula. And the chest and the abdominal x-ray with the tube in a place, that is what we are going to do with the another investigation, and the contrast study to identify with the fistula. So these are the different investigation or the diagnosis to rule out with the tracheoesophageal fistula. Then how we are going to do the management with the preoperative care, we are going to give with the child, that is nil per orally, that is nothing by mouth, to prevent the aspiration. Along with that suction of the oral and the pharyngeal secretion we are going to do, and the usually positioning especially we are going to do with the head elevate to prevent the reflexes, and oxygen therapy if it is needed. Along with that we are going to give with the IV fluids and the antibiotic. Then surgical treatment, you has the condition is a congenital anomaly. Usually we are going to do with the surgical treatment only. That is a ligation of the fistula and the anastomosis of the esophagus. What we are going to do usually in surgical, usually it is performed within the first few days of the life only. Then coming to the post-operative care, has we are going to maintain the airway and the oxygen and monitoring for the infection and the anastomotic and we are going to make with the respiratory distress if it is there, that is also we have to monitor, and the gradual incision of the feeding, that is especially with the via nasogastric tube feeding or a oral route as per the surgeon advice. Along with that, provide the proper emotional support for the parents is the most important. So this is what the preoperative post-operative care what we are going to give for the child who will be having a tracheoesophageal fistula. Next we will see one more condition, usually which type of the question that will be asking, that is a cryptorchidism. So what do you mean by this? As condition in which what will happen here, one or both testes fail to descend into the scrotum, it will be there. What's the main causes for this? Either it may be like a hormonal imbalance, it will be there, or a prematurity, or it may be with the genetical or a mechanical factors. So usually the child will be having this condition, clinical features, it will be there like a empty of the scrotal sac, it will be there. Then there is a testis palpable in the inguinal canal or a abdomen, what you are going to see. Then usually the management of this condition, the observation we are going to do with the child till 6 months of the child. Sometimes what will happen, spontaneously descend, it may be hackers, or hormonal therapy we are going to give, and orchipexy, what the surgical correction we are going to do if it is not descend by the 1 to 2 years of the age. So the nursing care usually we are going to give with the preoperative and the post-operative care after the surgery. Along with that, we are going to educate the parents about the testicular self-examination and the follow-up. So the next topic we are going to discuss, that is a acute glomerulonephritis. So when you're coming to this acute glomerulonephritis, it's one of the inflammation of the glomeruli of the kidney. So usually what will happen this, either it may be happening with the streptococcal infection, that is leading with the kidney function and the fluid retention, it will be there. So the main causes for this acute glomerulonephritis, either it may be with the post streptococcal infection. Usually most of the condition of the child they come across with this acute glomerulonephritis usually because of this post streptococcal infection only. Usually after the like a throat or a skin infection caused by group A beta hemolytic streptococci, and the bacterial infection sometimes it may be happening with the pneumococcal or a staphylococcal, and the viral infection like a hepatitis B or a mumps or a measles or autoimmune disease if it is present, that is also causing with this acute glomerulonephritis. Then what's the main clinical features you come across with the child with this condition? There is a, generally you are going to see there is a lethargy will be there, malaise and the anorexia with the child. When you coming with this child will be having this condition, there is a hematuria will be there, that is a cola colored urine the child will be passing, and the proteinuria will be there, oliguria what you are going to see, and there is a edema, usually the edema, periorbital edema around the eyes you are going to see, and the generalized also it will be there. Then the cardiovascular condition, when you coming there is a hypertension and the headache the child will be having. Then other conditions, usually the features will be there like a abdominal pain, nausea, vomiting, all these things. Then treatment usually, when you coming to the investigation, usually with the urine analysis, if the child will be having like hematuria, oliguria, then we are going to do with the urine analysis. So in that we are going to check out with the hematuria and the proteinuria and the RBC cost. Along with that blood test also we are going to rule out, that is elevated with the BUN and the blood urea nitrogen. Along with that there is a creatine level also it will be there. Then there is a infection, especially with this condition it will be there. There is a post streptococcal infection, that is what you are going to check it out. Then there is a electrolyte imbalance will be there. Then for the rule out, for the confirmation we are going to do with the renal biopsy. Usually this condition renal biopsy in the rare cases only we are going to do if the like a treatment is not doing with the up to date. Then coming to the what's the management we are going to do, the medical management we are going to do with the treatment, that is a underlying condition of the infection. Like if the child will be having a any particular infection, bacterial infection is there, we are going to treat with that particular thing. And along with that, if the child is having a edema, we are going to treat with the diuretics, and the fluid and the salt restriction also we are going to advise for the parents. Then nursing management, usually we are going to assess the with the vital signs, that is along with that urine output and the weight gain, how it is there, to check out with the edema, and the fluid and the diet, restrict with the fluid, then low salt diet we are going to recommend. Along with that balanced nutrition we are going to tell for the parent. Then medication, usually administration of the given particular antibiotic, diuretics and the anti-hypertensive as per the prescription of the doctors, and the monitoring for the complication, that is especially what you are going to check out with the pulmonary edema, hypertension or a renal failure if it is present. Then we are going to educate for the parents especially about the importance of the follow-up, recognition of the sign of the complication, like if the child is having a concern with the vomiting, edema if it is present, all these things we have to give the proper education for the parents. Then coming to the one more condition, there is a cleft lip and the cleft palate. So what do you mean by this cleft lip? So cleft lip, it is also one of the congenital malformation or a congenital anomaly. So congenital deformity where there is a split or a opening in the upper lip due to incomplete fusion of the lip tissue during the fetal development. So either it can be like a unilateral, only one side it will be present, or it may be with the bilateral, either with the two side what you are going to see with the child. Then coming to the cleft palate. So cleft palate also, it is also one of the congenital defect. What will be there here? So there is an opening in the roof of the mouth, that is a roof of the mouth, that is a palate opening, it will be there because of the palate self fail to fuse. So it may be involving with the hard palate, soft palate, or it may be both. That can be occur alone, or it may be happening along with the cleft lip. So this is about the cleft lip and the cleft palate. For further explanation, you can visit with the Easy Nurse, so where you can able to download it with the App Store or a Play Store. Then coming to the pre-operative management and the post-operative management. So usually the question, it will be there with the nursing care of the child with the pre-operative and the post-operative nursing management. So coming to the pre-operative management, so what is the main care we are going to give for the child who is going for the surgery? So the main goal is ensure that proper nutrition, prevention of the infection, and prepare the child for the surgery. So the nursing care what you are going to give, that is a assess with the evaluating with the feeding, weight and the hydration status of the child. Along with that feeding support we are going to do, especially if the child will be having like a below 1 year of the age, whether the child is having a bottles feeding or a nipple feeding or a prevent with the aspiration, that is what we are going to check it out. And feed in upright positioning, and the small frequent feed only we are going to give for the child. And the prevention of the infection, keep the oral cavity should be clean, along with that monitoring for the signs of the respiratory infection. Then parental education we are going to give for the child. Parents teach about the parent feeding techniques and explain the surgical procedure and the expected outcome what it will be there. And the preparation for the surgery, usually assess for the anesthesia risk, along with that obtain the informed consent from the parents and ensure that pre-operative labs and the investigations are done before going for the surgery. Then post-operative nursing management, the care what you are going to give, the main goal of this, that is to promote the healing, prevention of the complication and support for the feeding and the growth. So the main nursing care we are going to give, that is the airway management, ensure the airway patency and watch for the respiratory distress. Along with that pain management, we are going to give administration of the prescribed analgesic what the doctors has been prescribed, monitoring for the comfort of the child. And the wound care is the most important, that is keep the suture lines clean and the dry. Along with that prevent the trauma to the surgical site, especially if the if the child is undergoing surgery, particular surgical site you have to see and prevent the trauma. And the feeding with the small, soft and the liquid feed as advised by the doctor. Avoid the feeding directly without the bottle if it is advised. May use with the syringe or some special feeding devices also we can able to use. Prevention for the infection, like monitoring for the redness, swelling or any discharge is coming from that particular surgical site. And the positioning, place the child in a especially in a supine or a slightly upright to reduce the stretch to reduce the stress on the suture line. Along with that, parental education is the most important. That is a teach the parents, that is a how to take care of the child after going to the home care of the wound and the feeding technique, like a different type of the technique, what if it is the doctor has advised. Along with that, schedule for the follow visit and monitoring for the healing and the speech development. Usually if the child who is undergoing with the cleft lip or a cleft palate surgery, so that one what you are going to look into that. So next it will be there like a question, like a nursing management of the child with the pharyngitis. So what do you remember pharyngitis? It is a inflammation of the pharynx, usually caused by the bacterial or a viral infection. So what's the main nursing care you are going to give for the child who will be having a pharyngitis? You have to assess with the sore throat, fever, difficulty swallowing, or any red pharynx it's there. You have to check it out, and the medication you are going to give for the child, like a antibiotic if it is like a bacterial infection if it is present, and analgesics also we can able to give if the child is having any pain or a fever. Then comfort measures, that is especially warm saline gargle, we can able to tell the child, and the hydration, especially encourage the child to drink more water to prevention of the dehydration. Along with that, isolation is the most important if it is a bacterial infection or a viral infection. And the nutrition, especially we are going to tell the child or a parents to eat with a soft diet, avoid spicy and acidic food what they are going to take should be avoided for a particular period of the time. And the parental education, complete antibiotic course, like if it is a bacterial infection, if they are prescribed any antibiotic medication, they have to complete that particular course, and recognize for the complication, like if the child will be having a fever as frequently if it is coming, that one we have to tell the parents. Next the question, it will be the conjunctivitis. Like what do you remember conjunctivitis? That is an inflammation of the conjunctiva, that is a membrane covering the eye. So main clinical features you are going to see with the child, usually the child will be having a redness of the eye, then there is a discharge, it will be there from the eye, that is a water or a purulent, and itching or a burning sensation it will be there, then swelling of the eyelids will be there. So usually the management, especially the nursing management you are going to give, so it is a maintain the high hygiene. So high hygiene is the most important, that's a cleaning the discharge with the sterile cotton. That is usually we are going to clean the eye with the sterile cotton, usually from the inner canthus of the eye to the outer canthus. Then administration of the medication, that is a antibiotic or antiviral eye drops as prescribed by the doctors, and prevent for the spread, that is a frequently hand wash and avoid for the sharing of the towels. That is what we are going to advise for the child along with the child parents. Then encourage the avoid rubbing of the eyes, that is what we are going to tell the child. So these are the nursing management for the conjunctivitis. Then what do you mean by weaning? So usually the weaning is a process of introducing the infant, like if the child who is taking a exclusive breastfeeding, once that 6 months is happening, so soon after the 6 months we are going to introduce the solid or a semi-solid food while reducing with the breast milk or a formula intake of the milk. So what are the main principles? We have to keep it in our mind when you are going to start with the weaning. So the main thing, that is a start around 6 months of the age, like or soon after the completion of the 6 months of the age only we are going to start with this weaning. Then introduce one food at a time. Along with that, maintaining with the hygienic practices, that is what we are going to tell for the parents, especially for the mother. And encourage for the self-feeding as a development as hello, like if the child is reaching with the 9 months, 10 months, then by that time we can encourage the child to take by eat by themselves, that is self-feeding, and observe for the allergies, like if the child will be having any allergy soon after the feeding that started with the weaning, that one as we have to tell the mothers to observe for the allergies. Then what are the main characteristics of the weaning? So the characteristics of the weaning, like first one is a gradual process. So the weaning is a gradual process. We are going to start from the smaller by smaller, that is from the weaning is with the slow and the progressive nature it will be there. Then age appropriated, it should be begins around the 6 months, usually after the completion of the 6 months only we have to start with this weaning. Till that we have to tell the mother to give the exclusive breastfeeding. Then nutritional adequate, that is when you are going to start with the weaning, the food introduced should be with the rich in protein, calorie, vitamins and the minerals. Then one more characteristics is that is easily digestible. So whatever the food we are going to give for the child, it should be very soft, semi-solid and easy to digest for the infant, then culturally accepted. Like whatever the food we are going to give, that it should be based on the culture of the family, like whether how the eating pattern of the family it will be there. On the basis of the only we are going to give with the local availability what it will be there. Then hygienic prepared, like the whatever the weaning food what we are going to prepare for the child, it should be with the maintaining of the clean utensils and the safe water. Then child center, so the child center means the pace of the weaning should be depend on the child readiness and the acceptance. Then one more is continue breastfeeding up to 2 years behind. So if the mother who started with the weaning also, we have to tell the mother continue the breastfeeding till the 2 years of the age. So these are the characteristics of the weaning. Then coming to the iron deficiency anemia. So what do you remember this iron deficiency anemia? So here what will happen in a condition where there is a insufficient iron to produce the hemoglobin, it will be that will be leading with the decreased or oxygen carrying capacity of the blood. So because of the insufficient iron to produce the hemoglobin, that will be leading with the decreased oxygen carrying capacity of the blood. So what are the main causes for this iron deficiency anemia? Either it may be because of the inadequate dietary intake, like if the vegetarians who will be there are a poor weaning practices if they are done for the baby, or if the children who are not taking a proper food, so that is an inadequate dietary intake that will be causing for the iron deficiency anemia. And the blood loss, if the child will be having like any gastrointestinal bleeding or a worm infestation, if it is present also there is a chances. And there is a premature birth, that is also one of the cause for this condition. And the chronic illness, like if the child will be having any chronic illness, frequently infection is there, so by that time also there is chances of getting this iron deficiency anemia. Then what's the main clinical features? Usually the child will be having a pallor, that is what usually we are going to see, especially over on the conjunctiva and the Nile beds. Then the fatigue will be the lethargy, irritability, poor appetite will be there. Pica, it's the most common thing what you are going to see with the child. Usually the child will be craving for the non-food items. Then there is a tachycardia will be there. So these are the clinical features of the child who will be having a iron deficiency anemia. So what's the main nursing management of the child you are going to give with the iron deficiency anemia? That is usually the nursing management. First one is an assessment. What are the assessment you are going to do? That is a monitoring of the hemoglobin level and the hematocrit growth and development of the child you are going to assess. Then nutrition, that is what you are going to give the proper nutrition for the child, providing with the iron rich food, that will be including with the meat, egg, green leafy vegetables and the legumes. So these are the main iron rich food we are going to give for the child. Iron supplementation, that's the most thing you are going to give if the child will be having a iron deficiency anemia. Administering of the iron, oral iron drops or a syrup as prescribed by the doctors, and the monitoring for the side effect, like if the child will be having any GI upset, that's any constipation is there or a dog stool is there, that is what we are going to check it out. And the parental education, that is especially we are going to give for the parents, give iron between the meals for the better absorption. And we are going to avoiding with the tea, especially with milk, and encouraging follow-up. And if the child will be having a continue of the therapy, we have to tell the parents to make the proper follow-up. So these are the nursing management of the child with the iron deficiency anemia. For more explanation, you can visit the Easy Nurse, where you can able to download it with the App Store or a Web Store. So next condition is a hydrocephalus. So what do you remember this hydrocephalus? Hydrocephalus, it is characterized by excessive accumulation of the cerebrospinal fluid, that is a CSF, in the ventricle of the brain, that will be leading with the increase with the intracranial pressure and the enlargement of the head, it will be there in the infant. So which are the different type of the hydrocephalus? There is a congenital hydrocephalus. Usually it will be present at the time of the birth itself, that is caused by the genetical factor, or it may be intrauterine infection. Then there is an acquired hydrocephalus. Usually it will be develops after, like a if the child will be having any infection, like any meningitis, if it is there, that is causing with the secondary infection of this hydrocephalus, or if the child will be having a trauma, hemorrhage or a tumor, that will be causing with this hydrocephalus. Then coming to the communicating hydrocephalus. In this communicating hydrocephalus, usually what will happen, this cerebrospinal fluid flows freely between the ventricles, but absorption is impaired, it will be there. Then non-communicative hydrocephalus, usually what will happen? Your cerebrospinal fluid flow is blocked in the ventricles, it will be there with this condition. So these are the different type of the hydrocephalus. Next, we will see what are the main causes for this hydrocephalus. Either it may be congenital malformation, it will be there as with the child will be having a spina bifida, or intraventricular hemorrhage if it is present in a preterm infant, or if the CNS infection, there is a central nervous infection, especially if the child will be having a meningitis, that will be causing with this, and the brain tumors or a trauma, all this causes for this hydrocephalus. So usually the clinical features you are going to see in an infant child. So there is a rapid enlargement of the head circumferences, it will be there. Then there is a bulging fontanelles, you are going to see scalp vein prominent, will be there. Then poor feeding and the vomiting. Then there is a irritability or a lethargy, and the sunset high usually you are going to see with this child, that is a downward deviation of the eyes. Then coming to the in the older children, what are the main clinical features you are going to see with this hydrocephalus? Usually the child will be having a headache, nausea, vomiting, and the papilledema, usually swelling of the optic disc, it will be there. There is a gait disturbance you are going to see with this, and there is a cognitive impairment, it will be there with the child, and there is a behavioral changes also you are going to see. Then how the investigation you are going to do with this hydrocephalus? Usually with the ultrasound and the CT scan, MRI, along with that we are going to do with the fundoscopy to check for the papilledema. Then usually the management you are going to do with the medical management, that is especially to reduce with this intracranial pressure by giving a proper diuretics, and in the mild cases usually with this we are going to do with the giving a diuretics, and the treating with the underlying causes, like if the child will be having any infection or a tumor, and along with that surgical correction we are going to make it out, that's a ventricular peritoneal shunt, usually most commonly the surgical correction you are going to do. Along with that endoscopic third ventriculostomy you are going to do for the some obstructive hydrocephalus if it is present. Then the nursing management, the proper assessment they are going to do, that is a monitoring with the head circumference and the checking with the vital signs. Along with that they are going to check with the neurological status also, along with the all these things, the main assessment they are going to do. Along with that positioning of the child, that is keeping the head elevated to promote the venous drainage, and the preoperative and the postoperative care they are going to give with the child, that is a monitoring for the infection and the shunt malfunctioning if it is present, and maintaining with the sterile care at the incision site. Along with that observe for the sign of the increased intracranial pressure. If the child will be having like a vomiting, irritability, or a bulging fontanelle, that is what you are going to check it out. And the nutrition and the hygiene we are going to maintain with the proper adequate intake of the fluid, and parental education, that is the most important, that is the care of the shunt, recognizing of the signs of the complication, and the regular follow-up. So for the further explanation you can visit the Easy Nurse, where you can able to download it in the App Store or a Play Store. Then coming to the role of the pediatric nurse in a child care. So you all know the nurses play a very multifactorial role with the caring of the child to promoting with the health and well-being of the children. So as she is acting like a primary caregiver. So you all know when you coming with the primary caregiver, she is going to give a direct care for the child, especially monitoring of the growth and development of the child, and the health education she is going to give for the parents, especially with the children's nutrition, hygiene, immunization. Then she is also act like a counselor, especially she is going to give the proper emotional support with the child and the parents also. Then advocate, she is acting like a protecting with the child rights. Along with that she is acting like a manager role, that is coordinating with the plans and the organizing, coordinating with the many team members, especially in a hospital setup. And she also acting like a researcher, participating with the studies to improving with the pediatric care, as with the giving evidence-based practices. And the therapeutic nurse, like she is administering with the medication, manages with the procedures, and ensure with the comfort of the child. And she also acting like a recreational facilitator, that is encouraging the child, especially with the play and the developmental activities. So these are the different roles as a pediatric nurse she is going to do with the caring of the child. Then coming to the next question, it will be that is a play and it's important. So what do you mean by play? Play is an activity, as you all know, that will be allows the child to explore, learn and express by themselves. So what is the main importance of this play? So this, when the child is playing, what will happen? There enhances with the physical development. That is a child muscle strength, it is increases coordination, it will be increases and promoting with the cognitive development. So the child can able to do with the problem solving and the creative thinking, it will be enhancing, that is with the cognitive development, and the supportive skills, social skills, it will be increases, that is a sharing, cooperation and the communication with the other child, as with the improving with the social personality and improving with the emotional well-being. That is as this play, what will happen, that reduces the stress in the child and builds the confidence. Along with that, aids in the recovery from the illness by providing the distraction and the normalcy. So these are the main importance of the play. Then there is a different type of the play that is based on the developmental stage. So coming to the sensoromotor, that is what usually in the infant child they are going to play, and the parallel usually in a toddler period, and the associative play usually they are going to play in a preschooler, and the cooperative play they are going to play in a school age, and the adolescents play usually they are going to play, that is between the 12 to 18 years of the age. Then coming to the based on the social interaction, like how the social interaction, it will be enhances with this different type of the play according to the different age group of the child. So coming to the solitary play, usually the child will be play in an infant, the child will be play alone. Then onlooker play, usually it will be there with the observing with the another child. So that is what playing without joining, usually the child will be observing what others are doing. Then parallel play, usually this is what you are going to see in a toddler age, usually child play next to other without any interaction. Then associative play, usually the child interact without organized with the any rules, there is no rules and regulation, it will be there, but the child will be playing with the associative play. And the cooperative play, organized play with the proper rules and regulation and with the teamwork. Then coming to the midday meal program. So coming to the midday meal program, this is a government initiative to provide the proper nutritional meal to school children to improve their health and reduce the malnutrition in the child. So what are the main objectives of this? That is encourage the school attendance, reduce the dropout rates in the children and improve the nutritional status of the children, promote the social equity. Then what's the role of the pediatric nurse here, as she is going to monitoring with the nutritional quality, educating the children and the family about the healthy eating habits, and they report the health issue related to the malnutrition. Next question, it will be there like a oxygen administration in the children's. So what's the main purpose of the oxygen administration in the children's? To maintain the adequate oxygenation in the children's with the any respiratory distress if it is present, or a hypoxemia. So there is a different methods, that's a nasal cannula, low flow, comfortable, it will be there, and the face mask, moderate to high oxygen concentration, it will be there with this, and the oxygen wood or a tent usually we are going to give for the infant, and the mechanical ventilator in a critical cases we are going to give. So what's the nursing care? Usually they have to take care when the oxygen administration we are going to give for the child. So assess with the respiratory rate, we are going to check with the respiratory rate and the effort oxygen saturation, then proper fit of the device, and along with that securing with the tubing, that is what we have to check it out, monitoring for the sign of the oxygen toxicity or hypoxia, and the maintaining with the humidification to prevent with the dryness, and educate the parents about the oxygen therapy. For the further explanation, you can visit the Easy Nurse, where you can able to download it in a Play Store or a App Store. Then coming to the international accepted rights of the child. So as adopted by the UNICEF or a United Nations Convention of the Rights of the Child. So which are the main rights of the child? As you all know, right to survival of the life, health, nutrition and the shelter, right to development, education, play and the leisure, right to protection, that is protection from the abuse, exploitation and the neglect, and the right to participation, that is the freedom of expression, involvement in the decision affecting with the child. So these are the rights of the child. Then coming to the one more condition, usually that will be frequently asking in a question and answer with the exam purpose, that is a pyloric stenosis. What do you mean by this pyloric stenosis? Pyloric stenosis is a condition in infant where the pylorus, usually it becoming abnormally thickened, that will be leading with the obstruction of the gastric emptying. So main causes for this pyloric stenosis, the exact cause is unknown. Either it may be some factor like a predisposing factor with the environmental or a genetical factor, it will be there. Mostly common in a firstborn of the male child, usually possible association with the maternal use of the macrolide antibiotic in early infants. Then coming to the clinical features, usually if the child will be having this pyloric stenosis, the child will be having like a projectile vomiting, it will be there, that is after feeding. Then there is a persistent hunger and the irritability will be there. Dehydration usually you are going to see with this, and there is a weight loss, usually poor weight gain, and the visible peristaltic wave, especially from left to right after the feeding. Then palpable olive shaped mass in the right abdomen. This is what the classic sign of the pyloric stenosis. Then usually investigation we are going to do with this pyloric stenosis with the proper with the ultrasound of the abdomen only we can able to confirm that there is a thickening of the pylorus will be there, and the blood test along with that barium study also we can able to do it to rule out with the condition. The management, medical management, usually with this preoperative correction of the dehydration and along with the electrolyte imbalance, that is what IV fluid and the potassium replacement you are going to do. And the surgical management, usually with this condition who will be having a pyloric stenosis, pyloromyectomy, that surgical correction they are going to do with this condition. Then coming to the another question, usually it will be there like a rheumatic fever. So what do you remember this rheumatic fever? It is one of the acute inflammatory autoimmune disease that causes the after A group A beta hemolytic streptococcus, that is especially with the throat infection. It attacks with the heart, joint, skin, central nervous system. Usually main causes for this rheumatic fever, that is a predisposing or there is a infection, it will be there with the streptococcal pharyngitis, it will be there 2 to 3 weeks priorly, and the autoimmune reaction, that is a antibiotics produces the agonist with the streptococcal antigen cross reactivity with the body tissues, it will be happening along with the predisposing factors, like if the child it belongs with the poor socioeconomic condition or a overcrowding of the population if it is present, or a delay in the treatment of the strep throat if it is there, that is also one of the causes for this rheumatic fever. Then clinical features, usually we are going to check it out with this clinical feature like with the major manifestation, that with the Jones criteria. So coming to this major manifestation of the Jones criteria, that is with the carditis, what will happen? There is a tachycardia, you are going to see murmur, cardiomegaly will be there, along with that pericardial rub it will be there. Then polyarthritis it will be there, that is what the painful joint pain it will be there. Then there is a chorea, syndromus chorea will be the involuntary jerky movements you are going to see. Then there is a erythema migrinatum, that is what the pink non-pyrrolitic ring shaped of the rashes you are going to see. And there is a subcutaneous nodules, usually some small painless nodules over on the joints you are going to see with this condition of the rheumatic fever. Then coming to the minor manifestation, that is what you are going to observe with the child. There is a fever will be there, arthalgia will be there, usually joint pain without any swelling. Then there is a elevated with the ESR and the CRP level. Along with that there is a prolonged PR interval on the ECG, that is what you are going to see. Investigation with the proper throat culture, that is what you are going to look it out, and the anti-streptolysin, that is titer, that will be elevated, and the ESR and the CRP level usually it will be increases. Then there is a ECG that will be detecting with this condition. Then management, usually the management of the medical management we are going to give with the proper antibiotic, that is with the proper penicillin as an antibiotic to treat with the bacterial infection, and the anti-inflammatory, that is also we are going to give with the corticosteroids for the arthritis and the carditis, and the supportive care with the proper bed rest during with the acute failure. Along with that management of the heart failure if it is present with the as a complication of the carditis we are going to do. Then nursing management, usually we are going to assess with the proper monitoring of the vital signs and the cardiac function, joint pain, neurological signs, all these things. Comfort measures we are going to give for the child. Along with that, medication administration as prescribed by the doctors and the proper parent education we are going to give, along with the proper psychological support. Then one more type of the question it will be there, like a protein energy malnutrition. So list the predisposing factor of this protein energy malnutrition, then explain the nursing management of the protein energy malnutrition. So protein energy malnutrition is a nutritional disorder caused by deficiency of the both protein and the calories. Commonly you are going to see in the children. So that will be leading, like if the child will be having a protein energy malnutrition, that will be leading with the growth retardation, it will be there, weight loss will be there, various clinical condition you are going to come across with this protein energy malnutrition, that is a kwashiorkor and the marasmus. So coming to the main predisposing factors for this protein energy malnutrition, like a poverty or a inadequate food intake, or a early weaning, or a improper feeding practices what they are going to do for the child. Then there is a repeated infection if it is present, like a diarrhea or a respiratory tract infection, measles, poor maternal education, like if the mother is not that much educated to give the proper nutrition for the child, and the large family or a low birth weight of the child. So these are the main causes for the protein energy malnutrition. Then what is the nursing management we are going to do for the child who will be having this protein energy malnutrition? Usually with the nutritional care is the most important, that is a providing with the high protein. So it's the most important. Along with that, high calorie diet in a small frequent meals we are going to give for the child. Fluid and the electrolyte balance, that's the correction of the dehydration and the electrolyte imbalance if it is present, and the infection control, that is especially we are going to administer the antibiotic and maintaining of the hygiene. Along with that, health education we are going to give for the parent to teach a mother especially about the balanced diet, breastfeeding and the weaning practices. Along with that, monitoring of the child, that is a child recording of the weight, growth, response to the treatment regularly. This is what the proper monitoring we are going to do with the child who will be having a protein energy malnutrition. So for the further explanation, you can visit the Easy Nurse where you can able to download it in a App Store or a Play Store. So these are the main important question. It will be there for the you go through this. If you have any doubt, you can visit with the Easy Nurse, or you can able to contact with the Easy Nurse. Keep learning, keep exploring with Easy Nurse. Thank you.